And to shed more light on this topic, I'm so delighted to be accompanied over the phone by Dr. Saeed Abdulhadi, the former Dean of Mansoura Faculty of Medicine. Good evening, Doctor.
Good evening.
Well, Doctor, what was the main purpose of His Excellency Prime Minister's visit to the healthcare institutions today?
Yeah, this is a continuation of the great effort done by the Prime Minister and the Cabinet to improve, upgrade, and increase the number of qualified hospitals, particularly in the capital, including Cairo and Giza. Today, they visited one of these facilities, but also in the meantime, there are 5 other big hospitals that are going to be refurbished and improved its infrastructure. This is important to modernize and upgrade the health facilities, in particular, as an arm for the whole improvement of the health service within Egypt. The capital, and particularly Cairo and Giza and also Calliopeia, will come in the final phase of the comprehensive health insurance, and this may take another 4 years or so. However, in the meantime, the Prime Minister and the Ministry of Health also strengthened the value of upgrading these hospitals in the capital as well as in other big cities in preparation for the comprehensive health insurance. And the hospital itself will be modernized in buildings as well as infrastructure, especially the telecommunication facilities, the computer registration kind of things, and also the training of the staff, including the physicians, the nurses, and the associates. So it's one step forward towards more robust and more capable health sector, which, in addition to education, is the prime interest of His Excellency the President Abdulhadi.
And Doctor, how will the improvement benefit citizens in Upper Egypt and other underserved areas?
Yeah, as you know, this is the area who the majority is least privileged, not as part of wealthy parts of Cairo, in Block Ablaila, Block Dukru, and El Haram, and all these areas. They are in dire need for improvement and for updated and modern healthcare service. So this is a step forward towards improving and empowering the healthcare facilities to become up to date. So each citizen would find the healthcare service he needs in the proper time, including the emergency service and this kind of thing. So indeed, the upgrading the facility within this area in dire need is a very good step and very clever initiative from the government to improve the quality of life for Egyptians, both poor and in need.
And of course, Doctor, this reflects Egypt's strategy, of course, and its Agenda 2030, work in parallel, the government work in parallel in all sectors. But how does healthcare developments also align with Egypt's long-term health strategy?
Yeah, as I said before, Egypt has the mega project of the comprehensive health insurance, which now covering so many governorates, started 4 or 5 years ago back, and we are carrying on till 2030 and beyond. So the step today is preparing and raising the capacity and modernization of the health facility in the capital. But as I said in the beginning, it's not only limited to the capital. There is an initiative to upgrade health facilities and empower it, both with infrastructure and with personnel all through Egypt. So very soon this year, there will be another 5 governorates going into the comprehensive health insurance. But in the meantime, all governorates, including the final phases like the capital, are witnessing improvement and upgrading and pushing more investment in the healthcare facilities, which is really good for the Egyptians and good as a record for the Ministry of Health and the government as a whole.
Well, Doctor, of course, there were two channels working with, or also the Prime Minister also encouraging the private sector working with it, trying to improve this sector, as you said. Of course, lots of initiatives by His Excellency President Abdel Fattah al-Sisi when it comes to 100 million health or other initiatives, conquering virus C and other initiatives for women.
Yeah, of course, of course. The President himself has put a very tentative agenda which actually has achieved success. This success is well recognized both locally, nationally, and even internationally. The 100 Women Health Initiative, the Women's Initiative, the Cancer Prevention Initiative, the children and pediatric age and improving the health of the youngsters. All these have increased the awareness of the population and has raised what's called the general health of the Egyptians. Of course, year by year, the life expectancy of Egyptians is increasing, as well as the facilities of healthcare service, including, not excluding, but including the private sector. So it's all coming together to improve the quality of life of the Egyptians, because health and education and life expectancy and the decent life, all these will increase the good quality of life for the Egyptians, but in the center of the good quality is the health and education.
Well, Dr. Saeed Abdulhadi, the former Dean of the Mansoura Faculty of Medicine, I would like to thank you so much for your informative call.